Welcome to the ER. How can I help you?
My knees are killing me.
Oh wow, they're really swollen. When did this happen?
4 days ago? It's starting to get hard to walk today.
I'll get you a wheelchair. Any past medical history, surgeries, or allergies?
Just diabetes. And I'm lactose intolerant, which is why I think this is happening.
Why would that have anything to do with your knees?
Well, I wanted my bones to grow stronger, and I've always wanted to be a little taller, you know?
And?
So I started using my insulin needles to inject low-fat milk into my knees.
Low-fat milk? Why?
You think I should have done whole-fat milk?
No, no milk! Why would you put milk in your knees? Who told you to do that?
It's supposed to be good for your bones.
When you drink it, your knees are clearly infected. We have to drain them before you develop septic arthritis.
No, don't drain them. The only reason this is happening is because I'm lactose intolerant.
What do you expect us to do then?
Just give me something for the lactose intolerance and leave the milk in there. Please. I have a date this weekend, and on my dating profile, I put that I was 2 inches taller than I really am. I'm hoping the milk kicks in by then.
Ambulance is here. What you got? 27-year-old male found unconscious in his home. His female partner called it in. Said they were shrimping right before he passed out. What is shrimping? That is when a man ejaculates into a woman's rectum, then inserts a straw to suck out the semen and blow it back into her mouth.
Really?
According to the female partner, yes.
Why did he pass out?
Well, because when he inserted the straw, she farted.
Huh. Is he awake now?
Yep, vitals are stable, female partner's on the way. Good luck. 518, all clear. Move out!
Welcome to the ER, sir. How can I help you?
I think my daughter swallowed a penny.
Tata. Doesn't look like she's doing too bad.
Can I get her name and date of birth?
Oh. Shoot.
You don't know your daughter's name and date of birth?
My wife is usually here with me. Oh, let me check my tattoos.
Your what?
Tata. Sophia Sorrento, July 6th, 2022.
Got it. If you hear your name, please follow me. Rice. Is there a Rice here? It's Ricky. Rick? E? Yeah, the E's capitalized. I don't know if you can see it. Yeah, no, I see it now. Is there a Millie? Mlee?
I think you're trying to say Emily.
How is this Emily?
M-L-E. Duh. Can't you spell?
Guess not. Okay, lastly, is there a ADC? A DC?
Oh, yep, that's me. It's Odyssey, bro. Odyssey.
Of course it is. Alright, everybody, follow me. If you hear your name, please follow me. Is there a Kavilin? Kavilin?
Oh, actually, it's Caitlin.
How is this Caitlin?
It's spelled with Roman numerals. It's unique.
Right. Okay. Is there a Ison? Tyson?
It's Addison.
Addison. I see. My mistake.
You're forgiven.
Lastly, do we have a Tur here? Tur? That's probably me. You're Tur? It's Lester. Of course it is.
You can't get rid of me, bitch. I'm not going nowhere. I'm not going no fucking where.
How you doing in here, Jenny? I still feel nauseous. Well, it makes sense. We got your test back. You're pregnant.
What? I can't be pregnant
Why not?
because I just graduated. No, I'm the first in my family to graduate high school. I have to go to college.
You can still go to college. There's a lot of options you have with the pregnancy.
How can I be pregnant? I don't understand.
Are you sexually active and using birth control like condoms? My boyfriend doesn't like using condoms. We've been using spermicidal foam. Spermicide isn't always 100% effective. It's actually one of the least effective ways to protect yourself during sex, especially when used by itself. You should always use it with a condom.
Well, for as bad as it tastes, it should work better.
You're not supposed to put it in your mouth.
Where do you put it then?
It goes in the vagina, 10 to 15 minutes before having sex.
How was I supposed to know that?
There's usually instructions on the box. Are you sure you're ready for college?
Oh, hell.
Welcome to the ER, sir. How can I help you?
I slipped and fell on a water bottle.
Oh.
It's stuck in my butt and I can't get it out.
Is it a plastic water bottle?
Yeah.
Okay, we'll get an x-ray to see where it is, and then we'll help you get it out. Hello?
Hey, Austin, you should look at the x-ray for bed too. Water bottle butt guy wasn't exactly telling the truth.
What the... Sir, we got your x-rays back.
Do you see the water bottle?
We see 2 water bottles.
What? Oh! That's right! I have 2!
How did you forget that?
I put the first one up a few days ago. I guess I forgot. Can you get them both out?
Yes, the surgeon's coming down to talk to you right now.
Okay. Thanks! Ma'am, you are having abdominal pain because you are pregnant.
There is no way! I can't be pregnant!
We tested your urine sample. You're pregnant.
I'm telling you, that's not possible!
Are you sexually active?
What? No, not exactly.
It's either a yes or a no. Are you sexually active?
No, I wouldn't say active. I kind of just lay there.
So that's a yes.
Can you just run the test again?
No! What to do if you think someone is overdosing? Signs of an overdose include they are unresponsive, have slow or no breathing, and pinpoint pupils. The first thing you want to do is give naloxone, a medication that can immediately reverse the effects of fentanyl. Over-the-counter naloxone is available for purchase without a prescription and can be found for free at community organizations in your area. Next, call 911 and give them very clear directions on how to get to the person who is overdosing. The faster the ambulance can get to them, the higher their chance of survival. If the individual is still unconscious after 2 to 3 minutes, spray a second dose of naloxone using a new naloxone container in the other nostril. Then lay the person on their side to prevent them from choking on their own vomit, and continue to monitor their condition and be prepared to take further action if needed. Stay safe out there, everyone. Welcome to the ER, ma'am. How can I help you?
I'm having some pain in my chest.
Okay, just lay back. We're going to do a quick EKG.
What's an EKG?
It's just going to take a picture of the electrical activity of your heart. Make sure you're not having a heart attack.
You're gonna do it right here?
Yep, just some stickers around your chest, arms, legs. I'm going to hook you up to this machine right here.
Oh. Okay.
Are you wearing a bra?
No.
That's okay. Pardon my reach. I'm just going to lift.
Ow! What was that?
Oh. Did you mean to put this there?
No.
Oh, well, here's $7 and your EKG looks good.
Oh, good. Thank you.
You're welcome. Welcome to the ER, ma'am. How can I help you?
Help me, please. My vagina's burning.
Have you ever had a UTI before?
I have, and it does not feel like this.
Could be an STD. Are you sexually active?
Yes.
Using protection?
Just anti-baby wipes.
Anti-baby wipes?
Yes, the same ones you have here.
Here where?
There.
These?
Yes.
These are bleach wipes. Why would you think they prevent pregnancies?
There's a picture of a baby on the side that's crossed out.
That means they shouldn't be used on babies!
Oh.
Well, looks like you have second-degree chemical burns on your labia.
Oh, no.
Also, your labs came back. You're pregnant.
No.
Yeah. These are condoms. Have you seen one of these before? Sir, it says you were here 2 days ago for the same groin problem. It didn't go away, so I came back. You left against medical advice after they found half a toenail clipper in your urethra. They said I needed surgery. I don't have time for surgery. I have things to do. How did you get half a toenail clipper stuck up your penis? Well, I thought I might have had a kidney stone. And I was trying to dig it out. When I squeezed the clippers, I must have lost one end. Really? Really?
We tested you for kidney stones. You don't have kidney stones. How are you still alive? Sir, you're being admitted for heart failure again. That's not good news. It's not, but you wouldn't be in this position if you just took your medication. Are you going to heaven, young man? I hope so. God doesn't take hope-sos. Do you pray? Can we please just talk about why you're not taking your medication? My religion forbids it. Your religion is not an excuse to not take your medication. If you believe in God, He will save you. Do you believe in God? I believe you've had quadruple bypass surgery, and if you don't start taking your medication, you're going to be seeing God in less than a month. So be it. Ugh. Hey, Mr. McDonald. Hope you're still doing okay. I have a new nurse here. This is Rena. Is it okay if she takes over your evaluation? Of course. How's it going, Rena? Hi. So, Mr. McDonald, as you know, you've been exposed to a potentially rabid cow. That's right. And you'll need the rabies vaccine to prevent infection. That's what they tell me. It'll be a series of injections depending on weight. Not a problem. 350 pounds. Oh no, I need your weight, not the cow's. 350 is my weight. Oh. Okay, thanks. We'll be right back. Hello, how can I help you? I need you to test this. What is that? It's my boyfriend's pubes on a towel. Ew! Oh my god! I almost touched that with my mouth! I need a paternity test to see if he's the father. We don't do that here. This is an ER. Well then can't you send it somewhere? This is a hospital. No. I need to know if he's the father. Why wouldn't your boyfriend be the father? Because I'm sleeping with another man and I don't know who got me pregnant. Ma'am, like I said, this is an ER. We don't do... Are you really going to deny a pregnant woman? No. Of course not. Let me just put this glove on and I'll take that from you. Hey, Austin, catch! What is this? Some dude's pubes on a towel. Oh, gross! Rich! Okay, all done. Test determined he is the father. But how? You didn't even get my DNA or the baby's. Oh. Right. If you aren't gonna test it, I want that hair back and I'll go to the hospital down the street. Well, I am not leaving until I get that hair back. Of course. Let me just put some gloves on. I'll be right back. Austin, where'd you put that towel? I burned it, Rich. Go away. Ugh. Fine. Okay. Ah! Oh. Okay. Here you go, ma'am. I found it. Finally. Useless. I'll find out who the father is myself. Good luck with that. Welcome to the ER, ma'am. How can I help you? It's my son. He developed a rash today. Well, it doesn't look like he's having any trouble breathing, so that's good. I'm just so worried. He's never had anything like this before. Does he have any allergies that you know of? No. Any new pets or animals that he's been around? No. Have you been using any new soaps? No. When did you notice the rash? Right around this morning, after breakfast. And what did he have for breakfast? Some blueberry waffles. 6 to be exact. Has he ever had blueberry waffles before? No. Never. He might be allergic to blueberries. But that's not possible. His rash isn't blue. Right? Let's just get you guys back. We'll figure it out.
Roger Coast, are you here?
Excuse me, sir. Do you remember me?
Yes. You fell off a bike yesterday.
And you guys said there was a small fracture in my arm.
Yes, I remember. Is everything okay?
You guys gave me my x-rays yesterday and they were black and white.
So?
I paid good money to be at this hospital and I get black and white x-rays?
Sir, all x-rays are black and white.
Really?
Yes.
Oh. Okay then. Thanks.
Roger Coast, are you here? Welcome to the ER. How can I help you?
I'm having a stomach ache.
When did it start?
Like an hour ago, after I swallowed a fork.
You swallowed a fork?
Yeah.
Why did you swallow a fork?
I wanted to see if I could do it.
What? Have you tried it before?
No.
You're sure you swallowed a fork?
Mm-hmm.
Okay, well, we're gonna need an x-ray just to be safe. Are you able to walk? Can you follow me?
Yeah. There is no way he swallowed an entire fork. You never know. I once had a pica patient who swallowed rocks and chunks of concrete. They can't help it.
Have you called psych yet, Ben? Not yet. I want to confirm the fork on the x-ray first. Oh, here it is.
Oh my god. What is all of that?
Sir, we got your x-rays back.
Do you see the fork?
Yes, we see the fork. We also see half a dozen coins, a toy car, and another object I can't even make out.
Oh, it's part of a TV remote. I knew it!
Rich! Sorry! Sir, this is very dangerous. You're gonna need surgery to remove these objects.
Oh, but those aren't bothering me. It's just the fork.
Sir, your pain is being caused by all the objects in your stomach.
No, those have been there for years. It only happened after the fork.
What do you mean, years?
I'm telling you, it's only the fork that's bothering me.
Alright, look. We can figure this out, okay? I'm gonna go get you some pain meds, and I'm gonna have some people come down to talk to you. Just don't move in the meantime. Okay?
Fine, but nothing except the fork is coming out.
That will be between you and the surgeon.
Welcome to the ER. How can I help you? My son has a fever of 325 degrees.
How did you check his temperature?
I touched my oven, and then I touched my son. They felt the same temperature.
I see. Let's just check it again here to be safe. Was your oven set to 325 degrees?
Yes.
I would suggest getting an actual thermometer to check his temperature next time. They are way more accurate. Look at that. No fever.
Oh, thank goodness.
Yeah, it's a miracle.
Hi. Aren't you lucky to be alive? Ma'am, you do not need a prescription for ibuprofen. You could buy it over the counter. I have bought it over the counter, and it's not the same. Yours is stronger. It is exactly the same. You said you gave me 600 milligrams for my pain.
Yes.
I only have 200 milligram tablets at home. Then you take 3 of them. But you only gave me 1 because the ER has 600 milligram tablets of ibuprofen. If you only have 200 milligram tablets, then you take 3 of them. It is the same thing. Can't you just give me the ones you have? No!
Alright, Anthony, I'm gonna start an IV on you. Why? Because the doctor ordered you some medication and I need to start an IV to give it to you.
Okay, but please tell me everything you're gonna do before you do it.
Of course. First thing I'm gonna do is tie this tourniquet around your arm to get a better look at your veins.
Ow, that's really tight!
It'll just be for a second.
It's too tight, you need to loosen it!
Okay, how's that?
That's better.
Okay, this is gonna be a little cold. I'm gonna clean the area.
What's in that?
It's just a little soap and disinfectant to clean the area before I put the IV in.
Okay, fine.
Here we go.
Ah!
Okay, here comes the needle. Big poke on 3. 1, 2, 3.
Ah!
Okay, all done.
Is that it?
Yep, just gotta flush it with a little saline and we can start your meds.
Whoa. What's in that?
Just some saline, a little salt and water.
No, I can't have that. I'm not allowed to have salt.
Oh, there's very little salt in here. It shouldn't affect you at all.
No, my doctor says I can't have salt because my heart is weak. Plus, it makes my stomach hurt. I'm on a no-salt diet. It should be in my chart. Please read it.
Anthony, this amount of salt should not affect your heart.
If you push that into my veins, it will give me a heart attack. Are you trying to kill me, you dumb mother...
52-year-old male with chief complaint of 8 out of 10 chest pain that radiates to his abdomen. Upon attempt to place patient IV, patient states that he does not want IV to be flushed with normal saline because it contains salt, which will make his abdominal pain worse and give him a heart attack. Attempted to explain to patient that there is minimal salt in saline, to which patient replies, quote, "Are you trying to kill me, you dumb motherfucker?" End quote. MD notified. Ordered a flush with dextrose instead. Patient agrees. No further incident at this time.
Help! What's going on, ma'am? She's going into labor. I'm her midwife. Oh, shoot. I knew I shouldn't have come out here. Ben, call labor and delivery. I need a vomit bowl. Here's a vomit bag. Someone get me a wheelchair. No, that's too small. I need something bigger. It's okay, honey. If you need to vomit, just vomit into the bag. It's not big enough. If you need a second vomit bag, I will get you one. Will someone get their ass out here right now? No, it's not gonna fit. What's not gonna fit? The baby. I need something to vomit the baby into. Oh, honey. It comes out the same way it went in. It's not coming out your mouth.
What? Ah!
Where is labor and delivery?
If you hear your name, please follow me. Tough Kane. Tough Kane, are you here?
I think you mean Tony.
Tony?
Yeah, Tony. Don't worry about it, man. No one gets it right the first time.
I wonder why. X10? Is there an X10 here?
It's Kristen.
How is that Kristen?
Seriously? Christmas, also known as Xmas? X is short for Chris.
Chris 10.
Present.
Leah? Is there a Leah here?
Oh, that's probably me.
You're Leah?
It's Ladasha.
Of course it is. Everyone follow me.
What's going on today, sir? My dad had knee surgery last week, and now he can't stop peeing. Not to worry, we'll get him checked out. Any pain in his knee? No. Anything else besides the frequent peeing? No. We will need a urine sample from him. I knew you'd say that, so I brought it.
Brought what?
His urine. Here. It's still warm.
Oh. Wow. Okay, give me a second.
Do you think it could be a UTI?
We'll know more once we get this to the lab.
I'll be back.
Ugh.
Okay, sir, What are you doing? Oh. Is it okay if I use this?
76-year-old male brought in by son for frequent urination and past medical history of left knee surgery. Upon initial assessment, patient's son provides a urine sample in a container that he collected from home. After urine was sent to the lab, patient's son was seen washing the container using the sink in patient's room. Advised patient's son against reusing containers with urine in it, to which son replies, quote, "Why would I throw away a perfectly good container?" End quote. MD notified. Social work consult requested. No further incident at this time.
Dorothy, are you sure you don't have anything metal below your waist?
No, I don't think so.
Well, we got your x-rays back, and there's definitely something metal in your pelvic area. Are you sure you didn't have any surgeries or maybe put something up there?
No, Oh, you know what it is.
Is that a dollar bill safety pin to your underwear?
It's in case I need to call a cab.
I see. Well, hold on to that, and we're gonna do the x-rays again, okay?
Can you hold it for me? I don't want to lose it.
Of course. Let me get some gloves.
Code blue! Patient's heart's not beating! Someone page the doctor and get me a crash cart! We need more blood! Ah!
Emergency room, how can I help you?
Hi, I gave my son a vitamin today, but I cut the vitamin in half before I gave it to him. How do I know which of the vitamins he got?
Ma'am, he gets half of all the vitamins.
Really? Oh, that's fantastic. Thank you.
You're welcome. Welcome to the ER. How can I help you?
I have these red lumps on my arms. They really hurt.
When did those start appearing?
A few days ago, I think. What are they?
That is an abscess caused by infection, and you have a few of them.
An infection? Am I gonna be okay?
Depends. What have you been injecting into your arms?
How did you...
Have you been using drugs to get high?
No, I'm not getting high.
Okay, then what are you injecting into your arms? Because it's clearly something, and you should probably stop. You're only 16.
Can I just see a doctor, please?
Yes, just a few more questions and I'll bring you back, okay? Austin, I put a patient in room 2. 16-year-old girl with multiple abscesses on her arms.
Multiple abscesses? From what?
Drug abuse. Duh, that's what I'm thinking, but she's denying drug abuse. Of course, they always do.
Were you able to get a urine sample?
Already sent to the lab. Her one other complaint, she's more tired than usual. Oh, 1000% drug abuse.
I guess we'll know soon. I'll go say hi. Hi, Charlotte. My name's Austin. I'm gonna be your nurse today.
What's gonna happen to me?
Well, these lumps on your arms are filled with pus from an infection. The doctor will come cut them open and drain them for you.
You're gonna cut me open?
Yes, but we'll numb you first. It won't be painful.
Oh no!
Can you tell me how you got them? That's okay. I'm gonna go get some supplies. I'll be back. Hey, Doc. Lidocaine's ready for you in room 2.
I'll be right there.
Did her labs come back?
Yep, she's clean. No drugs.
Really?
Yep, whatever she's injecting into her arms, it's not showing up in her urine. Huh. Can you also get me an IND kit and just be ready to wrap her up and get her out of here?
Sure thing. The doctor will be in soon.
Okay.
Look, we know it's not drugs, but it's really important we know how this happened to you so we can help you prevent it from happening again. You don't want to come back to the ER for this. Trust me.
I just hate how I look.
What do you mean?
Everyone makes fun of me for being so pale, and I'm tired of going to tanning salons.
So you're getting high because people are making fun of your skin?
No, I already told you, I'm not getting high.
Then what are you doing?
I went to the vitamin store and bought some over-the-counter melanin. I injected it into both my arms.
Charlotte, there's no such thing as over-the-counter melanin. You're either born with it or you're not.
Yes, there is. I still have the bottle. Look.
Charlotte, this is melatonin.
It's generic melanin.
No, they're different. This is a medication to help your circadian rhythm and sleep, not skin pigmentation. That's probably why you've been so sleepy.
Oh, that makes a lot of sense. Okay, who's ready to drain some pus? What just happened in here?
Oh my God.
Thank God.
Welcome to the ER. How can I help you?
I hurt my toe! Oh God, it hurts! Ugh.
How did you do that?
I stubbed it on a table leg, but like really violently. Ugh.
Sounds like you're in a lot of pain.
I am! It hurts! Oh!
We'll get you something for the pain, but we gotta do an x-ray first.
Okay. Ugh.
Austin, you got a patient in room 2, Mr. Rene, stubbed toe. He's in x-ray right now.
Thanks, Ben.
He's also being very dramatic, so either he shattered this toe or he's seeking pain meds. Definitely pain meds.
Thanks for the heads up. Hello?
Hello, this x-ray. Are you taking care of Mr. Rene?
Yes, I am. Is everything okay?
I need you to come to x-ray to help him get on the machine. He said he cannot move.
Oh, yes, of course. I'll be right there. Hi, Mr. Rene. We gotta get you onto the x-ray machine, okay?
I can't, man! It hurts!
I know, but we're gonna help you, right?
Ugh, I guess.
If I stand, I'm gonna faint from the pain. I know it!
We have to get this x-ray to see if your toe's broken, and then we can get you something for the pain, okay?
Okay, but you have to help me. I can't do it by myself.
On 3. 1,
2,
3.
Ah!
Oh my goodness, that was exhausting. Hello?
Hello, Mr. Rene, toe not broken. Goodbye.
What the? Hey! Oh, Doc, have you seen Mr. Rene yet?
I'm gonna go see him next.
Just so you know, his x-rays are negative and he might be seeking pain meds.
Got it.
Austin, you find out what's going on in room 2 yet? He's still screaming.
His toe isn't broken. I think you were right. He's seeking pain meds.
Well, he hasn't said anything about pain meds, but he does keep saying he needs to see a social worker for some reason.
What? Why?
I don't know.
Mr. Rene, what is going on?
It hurts! I need a social worker right away!
A social worker isn't going to help you get narcotics.
Why do people keep bringing up drugs? I want to see the social worker so I can start filling out the form.
A form? For what?
Because this is a workplace injury.
This happened at work?
Yes, it's a toe stubbing work injury, which is more common than you think, and I think I need some workers' comp.
Oh. Mr. Rene, your toe isn't even broken.
Well, something is wrong. I can't go back to work like this. Is there anything you could do?
Do you want something for the pain?
Just get me the social worker!
Okay, jeez.
It hurts!
Hey, I just gotta get your vitals, okay? How you feeling?
And then I go and spoil it all by saying something stupid like I love you. Pathetic, fat, bad, evil, no nuts. Poor, ugly, short guy. Pathetic little gay guy.
Okay, Mr. Brown, you're gonna get discharged.
Oh, well, who's gonna do it?
I am.
You're gonna suck me off?
What? No. What are you talking about?
If no one's gonna suck me off, how can I be discharged?
No, sir, I meant you're going home.
Oh, well, I'd still like to be discharged first.
No, sir, no one is going to... Damn it!
I don't mind if it's you. Help! My husband needs help!
What's going on, ma'am?
His penis is very swollen. I had an allergic reaction. Ugh! It feels like it's gonna fall off.
I'm gonna have you take your pants off. How did this happen?
It's all my fault. I read online that you could use coconut oil for vaginal dryness, but he has a nut allergy.
Gotcha. Okay. No worries. We'll get you back there and get that taken care of right now. Your husband is doing much better, ma'am. He's almost ready to go home.
Oh, thank you.
I would avoid any more coconut oil in the bedroom. Yes, of course. I would suggest trying other vaginal moisturizers like KY jelly.
Jelly?
Yes, KY jelly.
If I don't have KY jelly, can I use grape jelly?
No, nothing from the kitchen.
Oh, okay.
And I've got something for you right here. She's got a gun! It's a letter, Lisa.
Oh, I think a woman should be able to kill one man a month. What's that? He has like a disease or something where you can't talk. He had a stutter. When I was born, some of the doctors said I had the rib cage of a large cat, and some of the doctors said I had the heart of a lesbian.
Tips from the ER. Christmas. It's the one time of the year where we might find an empty ER waiting room. Any minor cuts and aches that you would normally come into the ER for can definitely wait until after Christmas. Nobody wants to spend their Christmas at the hospital, which means the days right after Christmas will be a complete and utter disaster. The waiting room will be full of sick and angry patients who waited until right after Christmas to see their doctor. But your doctors aren't working that week, are they? It's Christmas. Their offices are closed. You know what's never closed? The emergency room, which is where everyone is going to be, including the poor healthcare workers who have to work on that holiday. Add on to all of that the start of flu season, and you can bet the only gift healthcare workers will be receiving this year is another fun, tightly wrapped mental breakdown. Happy holidays, motherfuckers.
Tips from the ER. If you plan on getting frisky this holiday and stuffing your own stocking, make sure it has a flared face. This does not have a flared face. It is festive, looks fun, ribbed for your pleasure, but does not belong in your chimney. This looks fun. It's flared, but it doesn't have a flared base. Obviously, not a flared base. This candle holder, yes, flared base, and the right size. If you're feeling a little adventurous, here's a longer one. Also, flared base. You see how it can't get sucked into the hole? And for those at the top of the naughty list, we have this. Make sure to get a flared base, motherfuckers. Happy holidays.
And I've got something for you right here. She's got a gun! It's a letter, Lisa.
Hi, sir. What brought you into the ER today? Animal bite? What animal? A squirrel? Where did it bite you? My penis? How did that happen? Well, I was outside, and I saw a squirrel tail in the snow, and when I pulled it out, it bit me. Is there anything else going on or that you want to tell me? No. That's it. Have a seat in the waiting room. We'll call you in soon. Okay. Should I pull my pants back up? Yes.